Good evening, everyone. My name is Teresa, and I work for Medtronic. Tonight, I have the pleasure of hosting this webinar where you'll get to hear from Dr. Andy Ostrowski. Dr. Ostrowski completed his urological surgery residency training at the Mayo Clinic. He focuses on improving patient outcomes with minimal invasive procedures and incorporates the latest technological innovations into his practice. Dr. Trotsky specializes in all areas of the general adult urology. He has a special interest in treatments for overactive bladder, and he looks forward to discussing this more in detail tonight. Just a reminder, if you have any questions, please use the Q&A box at the bottom of your screen. With that being said, welcome, Dr. Ostrowski.
Well, thank you very much. Welcome everyone to tonight's talk. We are going to be talking about bladder and bowel dysfunction and what we can do to help with that. So appreciate you guys all joining in. And at the end, will be some time for Q&A. So please don't hesitate to ask any questions you do have. So overall, things that I would say many of you who have joined this call may be concerned about, with your bladder or bowels. Will you ever regain control? Will you be able to maintain your social life, attend celebrations, leave your house without worrying about accidents? Can you ever wear white pants again? All of these things are likely, to some extent, questions that may or may not have come through your thought process as you've gone through all this. But truly, this is a common set of occurrences for people. More than 64% of people that experience symptoms like overactive bladder or fecal incontinence have not currently or not currently using any treatments. And about 48% of people with OAB reported a loss in confidence, whether this is socially, in their ability to hold, just in all areas of life. And so definitely when something like this is going on, it's good to know you're not alone. And definitely a lot of this low confidence, a lot of that loss leads people too often to not seek the care they need. They're embarrassed or they think there's nothing that can be done. But definitely there is improvement and there's hope and things that we can do to help. And so we're going to go over a lot of that today. And so bladder and bowel issues are not inevitable. That's a common thing I hear in the clinic. Oh, this is just what life has dealt me. I'm going to be dealing with this no matter what. It is certainly something that is a very disruptive health issue. Definitely something that's common amongst a lot of our patients. Some of these symptoms may be happening, urinating more than 8 times a day, feeling like you have to go now and you've got to get there right away. A lot of people know every bathroom within a 5 square mile radius of their home. That's another very common situation. People who are using pads to control leakage, whether it's urinary or fecal, getting up multiple times at night to urinate, having to constantly watch what you drink because you're not sure you'll be able to make it. Things you may not have thought were possible, like taking your grandkids to lunch, sitting through a baseball game, or just enjoying a good night's sleep again. These are all things that we can help you get through. Depending on what your issue is, there is a solution. Bladder and bowel issues definitely can be embarrassing. They can have a significant impact on your quality of life. And definitely something that, more than one person on this call probably has been holding off on reaching out for care simply because they didn't know where to go. So let's keep going forward to give you some answers. Again, overall, you are not alone. Overactive bladder is extremely common. For example, it's more prevalent than vision problems and diabetes. Those are 2 issues you think about that are likely extremely common. And, it seems everyone we see has got either glasses or diabetes, but there's more people with bladder issues. You may be asking, if it's so common, why haven't I heard about it until now? And at the same time, many physicians don't realize how embarrassing it is for patients to talk about bladder control issues. A lot of physicians don't ask. Patients never bring it up, and so these issues just stay hidden. Like vision problems, bladder control issues can happen to people of any age. So we are not just talking about something that affects people in their 60s and 70s. There are patients in their teens and 20s and 30s that are also having these issues. Although your risk increases as you get older, that doesn't make it something you should accept, ignore, leave untreated. That can raise serious risks for your self-esteem, confidence, and general health. And so definitely something that we often will encourage patients, if there's something going on, don't hesitate to ask, bring it up. We can always see if there's something that can be done. So again, the good news, bladder and bowel treatments can get you back to more freedom, more life, and more control. So it is important to understand some of the basics of what can cause these issues to happen. You know, some are as simple as what the things we eat, the things we drink every day, as well as medications or vitamins we might be taking. Some are related to life events like childbirth. There are health conditions, numerous, that can be contributing. This is not just an issue for females, this is an issue for men as well. Prostates can lead to overactive bladder problems down the road as well. There's chances that at some point in your life, you may have injured your pelvic floor. And so our plan is to really go into some of this a little more detail. But ultimately, the biggest problem that we see for most patients is that somehow there's a miscommunication happening between the bladder and the brain, or the bowel and the brain, again, depending on which issue we're dealing with. And so to understand what your body is saying, it's important to know what communication is critical to how the bladder works. So bladder function involves the coordination of the brain and muscles through nerve signals. This little graphic is showing basically the signals coming up from the bladder, telling the brain messages, and the brain basically returning right back. As your bladder fills with urine, nerves tell your brain that it needs to be emptied. And so research suggests that bladder control problems are linked to essentially a poor bladder-brain communication, and vice versa for bowels. The brain sends a signal to the bladder telling it to empty. Essentially, you got to go to the bathroom, squeeze. So the bladder contracts, almost essentially like squeezing a balloon, and then the normal bladder would empty. For some patients, as their bladder begins to fill, it's already sending signals to the brain that it's full, or essentially it's being a little too eager to initiate that sequence. The brain doesn't give you time, therefore, to get your bladder to empty. It basically says, okay, you have to empty, go ahead and empty. It doesn't recognize that that's not the appropriate time. This overactivity of nerve signals results in that miscommunication between the bladder and the brain, or the bowel, and this is the source of our overactive symptoms. The closer you get, especially to the bathroom, many people will say, "Hey, I hear the water running, or I see the bathroom. I'm pulling into my driveway." Your bladder just starts immediately sending stronger signals, and those contractions can therefore create a stronger squeeze on the bladder, giving a much stronger urge to go. So keep these points in mind for later when we talk about the various treatments, how they differ from one another. Not only are you not alone, but help is available. We want you to get the help you deserve for your bladder and bowel problems. Essentially, it's important to remember, don't let your bladder and bowel control your life. And so there are numerous different issues that you would commonly come to see us for. Some of the bladder and bowel problems would be stress incontinence, urinary retention, overactive bladder, fecal incontinence. Important to know that some of these issues that might seem like problems with the bladder may not be, controlled by all of the treatments we talk about. And so I'm going to dive into these a little more, so it makes a little more sense what could be a good option. So stress incontinence, this is still leakage of urine. This is going to essentially be more related, though, to physical activities. So many people will say they leak when they sneeze, or they cough, or they laugh. Someone tickles them and out comes urine. When you exercise, lift heavy objects, gardening, where you're constantly going up and down from your kneeling position to your feet, you're lifting bags of soil. Climbing stairs or standing up from a chair. If you're finding that urine is just leaking out, whether it's a small amount or a large amount at moments like that where physical changes happen, oftentimes that would be stress incontinence. This type of incontinence typically requires a surgical correction. This is not related to the overactivity or miscommunication, but more a physical weakness or manifestation of something happening to the pelvic floor muscles or the urethra. And so definitely something that we fix, but the focus of this talk is going to be more focused on things like overactivity. Urinary retention, this is a very important area to really clarify the different types, but ultimately there would be two main types, obstructive or non-obstructive urinary retention. What we mean by that is essentially whether or not you have something causing a blockage, and that's why you can't empty your bladder. But if your bladder's drainage system is wide open, there's nothing actually preventing it from emptying other than the bladder misfunctioning. That would be non-obstructive, and that is something that we could treat with these type of treatments we're going to be diving into. With urinary retention, a lot of people can't always tell that their bladder is full. One of the most surprised looks I get from patients is when they come in and say, hey, my bladder's empty, and I go and tell them that it's actually completely full. A lot of people are unable to fully empty the bladder, or they at least can get a weak or dribbling stream. A lot of times situations like this lead patients to need to use a catheter. And another, again, because of the possibility of some form of physical obstruction, this is a type of urinary issue that would definitely need specialist workup with the urologist so we can determine the difference between what's happening and give you the right corrections. And so focusing into overactive bladder essentially, unlike stress incontinence, this has very little to do with the loss of support. This is going to be broken down into things like urge incontinence, urinary urgency, and urinary frequency. The urge incontinence is essentially that sudden urge to go to the bathroom, which also results in actual loss of urine. And so rather than saying I coughed or sneezed and urine came out, it's more that the bladder suddenly said it needed to go and you didn't have time to get to the bathroom. It's that gotta go right now. I have 1 minute, everything's okay, and the next I'm doing the pee dance all the way to the bathroom. Urinary urgency and frequency, this essentially breaks down to a constant urge that you have to go to the bathroom, or frequent trips to the bathroom, and in between those you're leading to leakage because you just, again, can't kind of keep up with how often you're having to go. That same sudden strong urge to urinate that results in an accident, and then 8 more later on that day, that's the kind of situation that we would consider under overactive bladder. Nocturia, also a subject that can be in here. This is where you make 2 or more visits to the toilet at night. This is essentially a fancy way to say you have to get up more often at night to pee. So when we talk about frequency, we're usually referring to the daytime, but it still applies to the nighttime. So if you're waking up more than once, you're not getting good rest. Your body isn't getting the deep sleep that it needs, and that's helpful for your health. And so ultimately, this can be something we can help control as well. Fecal incontinence, this is referring to essentially that inability to keep stool from coming out, whether it's you have a strong urge to go and you can't hold it in, or it could be that you don't even know that you have the need to go and stool just leaks out. Ultimately, this is something that creates a very large issue in patients' social life. People are constantly worried that they're not going to be able to keep that secret. They're going to be with a group of friends and they can't hide the smell of stool leaking out, or it's staining their clothes. And so essentially, if you find you are consistently having to plan every activity around being able to get into a bathroom, if you are losing the stool one way or the other, if stool presents every time you urinate, so that's something that a lot of people don't realize may be considered under the fecal incontinence. And then again, if you're using pads for stooling to keep it from staining your clothing, definitely something that we can discuss and can help with. One thing that I do always like people to understand or to clarify in these circumstances is that this is something that's more of a chronic issue. When we refer to patients who have, say, like a GI illness that's causing diarrhea, and that's the only incidence where they're having that leakage, this is not something that we're referring to with fecal incontinence. This is going to be more of a chronic, every day of their life type issue that we're referring to. And so now we're going to break down more into the ways that we can help manage the different types of incontinence and urinary issues. We're going to talk a little bit about lifestyle changes. We're going to talk a little about medications that can be used, and then we'll dive into the advanced therapies. And so lifestyle changes, most of the time, by the time anyone's coming in to see us, they've already gone through copious amounts of internet research. They may have talked to friends, they may have talked to their primary care doctor, and a lot of these types of things have been changed. And this is definitely the first place to start. Essentially trying to work on behaviors that you can use to help your situation. And so this might mean changing the things you eat and drink, whether it's decreasing caffeine intake or changing the foods you're eating, trying to cut out acidic foods or spicy foods, alcohol. Also could be focusing around getting more exercise, healthy body, healthy bladder, it all works together. It might involve bladder retraining, like delaying going to the bathroom or sticking to a urinating schedule or bowel schedule. Again, with the schedules, though, we don't want that to be something that's still, 20 times to the bathroom during a day. That's not a good schedule. That's something that, we're trying to keep it down, under 8 times or less. But again, some people just can't get it to work. Pelvic floor strengthening is also very important, and this can be done by repeatedly contracting and relaxing the muscles of the pelvic floor, also known as the Kegel exercise. A lot of people have heard of the Kegel exercise, especially women after childbearing. That's a common thing that's taught to them, but some people don't know how to do that. Sometimes a physical therapist is useful in actually teaching you those methods, but the way I like to explain it to everyone, essentially, it's that muscle you would generally contract down on when you're trying to stop your urine stream. It's that muscle you would squeeze to try to hold in any flatulence you would pass, or the muscle you're squeezing when you want to try to get to the bathroom in time. And so while, again, lifestyle changes are a very important starting point, by the time people are coming to see us, most of these lifestyle changes have already been done and generally have not fruited much effort. But again, it's definitely worth always starting here. So medications for specifically the bladder overactivity. These medications can control symptoms, but it is important to know they don't always work for everyone. And like any medicine, they can have side effects. Essentially, these medications work on the bladder muscles, not the nerves. They can control symptoms, but they do, again, have some drawbacks. Um, you have to remember to take these every day. These are medicines that have to, basically be constantly maintained in your system. If you miss a couple of days, you could actually push back your benefits quite a bit. Cost of medications is always a factor to keep into mind. Unfortunately, there are wonderful medicines, but most insurances will have different formularies for which they'll cover. A medicine that may work wonderfully for you may not be on your insurance's formulary. And unfortunately, while we can always try prior authorizations, the fact of the matter is that the majority of prior authorizations still fail, leaving most doctors and patients confused as to why it didn't get approved. And so that can be a very stressful situation for a lot of people. Again, medications do have side effects, ultimately dry mouth, blurry vision, constipation, elevated blood pressure. Unfortunately, in patients over the age of 65, some of these medicines can also actually cause confusion or memory loss, increasing concerns with dementia. And there was a survey that actually was performed and showed 72% of people say that ultimately they stopped taking their bladder medicines within 6 months for one of these reasons. And ultimately, again, as I mentioned, there's a National Institute of Aging study that was published in the Journal of American Medical Association, and essentially showed that elderly people taking a class of medicine for the bladder called anticholinergics are at greater risk for developing dementia. So when lifestyle modifications aren't working, when medications aren't working or barriers have been put in place to prevent them from being a good option for you, ultimately, more advanced therapies are available and would definitely be an area to be looking into. And so, one very common area that people see for bladder control would be medications injected into the bladder, which we'll dive into. And then again, the Medtronic InterStim system, which we'll be discussing further in a moment. For the bowel, essentially one of the great ways to manage this is the Medtronic InterStim system, but there are other surgical options that are generally much more invasive, much more full of complication risks. And so we'll talk a little bit more first about the bladder side. Botox, everyone, for the most part, has probably heard of this medicine. And believe it or not, it's not just for face wrinkles. It can actually be used to take the wrinkles out of your bladder. No, I'm just kidding about the wrinkle portion, but it can be used in the bladder. Botox essentially can be injected into the wall of your bladder, into the muscle, and this can have a paralytic effect on the muscles of the bladder. And yes, you did hear me right. We are paralyzing muscles of the bladder. So for many people, that probably raises an immediate concern. If you paralyze the bladder of or the muscles of my bladder, how am I going to urinate? Well, the whole goal would be to not inject into all of the muscles and to not paralyze too many of the muscles. But ultimately, that is a risk. Unfortunately, there will be patients who go through a therapy like this who do end up with urinary retention. So instead of overactive bladder, they start having retention. They flip the table on themselves. And in a case like that, that can cause them to need to catheterize. That can last anywhere from 9 to 12 months potentially until the Botox wears off. There's no way to really just turn off the Botox. It's in there until it goes away. The effectiveness of Botox is essentially comparable to oral medications. And ultimately, again, it's just working on the muscle, not working on the nerve, the communication pathway. About 67% of patients rather, did discontinue treatment after their first Botox injection. It's not to say that this can't be an option that works, but it is something that has a stigma against it with the concerns for retention. Over time, some people will find that they're able to go further and further without the Botox injections, but there are a lot of patients who essentially have to have these treatments on a regular basis, anywhere from every 6 to 12 months, coming in for a procedure to inject into the bladder. So it can be a big burden on patients. And so the moment everyone has been waiting for to hear about, we're going to talk a little more deeply on the sacral neuromodulation. And so the Medtronic InterStim system is what we use with Advanced Urology. This is essentially a therapy that's going to provide relief and restore bladder and bowel function by gently stimulating the sacral nerves. In our spinal cord, our spinal column, the lowest vertebrae are the sacral vertebrae, and the S3 vertebrae, or there's a nerve root rather that comes out, the S3 nerve root, that we are working to stimulate gently. So essentially, the way this would work, let's kind of describe a situation. If I'm having dinner in a loud restaurant and I have difficulty hearing, the person sitting at the table with me, the background noise interferes with our ability to communicate. And so essentially, if you can remove that background noise, you could likely hear your, table partner just fine. This therapy is essentially doing the same thing. There's so much distraction going on in the body that the brain and the bladder are not able to communicate properly. We are essentially removing that interference. We are ensuring that there is a simple and easy communication pathway between the bladder and the bowel, or bladder and the brain, or the bowel and the brain. This therapy works by delivering small electrical impulse that blocks out those inappropriate nerve signals, getting rid of that background noise, and allowing your bladder to talk to the brain or the bowel. Ultimately, it restores that normal communication and gives you back what you were expecting your bladder and bowel to be doing. Medtronic bladder control therapy is the only advanced therapy for overactive bladder that is clinically superior to medications. And there is a test that lets you try it first. So, who doesn't want to try it before you buy it? And ultimately, there are different versions of this. There is the rechargeable versus the recharge-free battery that allows you to kind of personalize your therapy to what goals match up perfect for you. Ultimately, you can see on this diagram here that the device is a small little implant that will go into the upper buttock area. And then there is a little wire that connects from there and goes down and rests next to that S3 nerve root. So as I mentioned, there's a test. You can try it first. And so for most patients, it just takes one simple evaluation. Ultimately, there are multiple versions of this test, but the simplest that we generally will start with is one called a percutaneous nerve evaluation, where essentially in our outpatient procedure center, we place tiny little thin wires down near those S3 nerve roots, one on each the right and left side. And that's attached to a little external device that is either taped or strapped to your back. And you go home and you get to actually see how this could work for you in your life doing your normal lifestyle activities. Another way to think about this is almost like a little tiny acupuncture test where we're poking these little acupuncture needles in rather than leaving them there poking straight out, though they lay flat underneath the bandage. So you would be able during that time to actually start or stop therapy. There's ways to adjust it. We have Medtronic reps that will work with you during that trial, reaching out basically to make sure you're seeing the success, and if not, helping you adjust it to get those symptoms resolved. And generally, these tests will last anywhere from 3 to 7 days. On average, my patients are finding the improvement they're looking for usually within the first 24 to 48 hours. The more advanced test does exist called a stage 1, where we can do a little more of an in-depth procedure for it. This would generally not be something we'd have to worry about unless you're unsure from the first test, but certainly something we can always talk about. After the evaluation period is done, you'll actually have an appointment back in the office with my team. And essentially, we'll be asking you how you saw improvement. Did you see less trips to the bathroom, or was your bladder actually starting to work better? Don't forget, this can be done for those non-obstructive retention patients. We might see patients with that who are not having to catheterize as often anymore. Fecal incontinence, did you have more control over the bowels? Ultimately, this would be always the starting point and a good way for you to see what this can really do in action. There is a My Journey app that Medtronic offers for any patient going through these procedures and trying this technology. It's a great way for you to be able to find personalized information, helping you to track your progress. There's different videos and educational content also that you can obtain on there. Certainly something that is an option for any patient to join. One of the common questions we get is, this is a medical implanted device. Can it go through an MRI? And the good news is, yes, there is MRI compatibility. So the Medtronic SureScan MRI system technology is what enables patients to get full body 1.5 and 3 Tesla MRI scans. It's the only sacral neuromodulation system with that SureScan technology within it. So that means there's no impedance checks required prior to an MRI scan. Scans allowed even if you've had an out of range impedances. MRI mode is easy to activate or deactivate on the Medtronic smart programmer that you would have without any clinician interaction. What I mean by that, you can easily turn this on and off at a whim's notice. There is a digital display that gives clear confirmation of MRI mode being activated, so there's no question that you've done it correctly. And so ultimately, one of the questions you'll have to ask yourself is whether or not this therapy is right for you. I think it's pretty clear cut. If you are having significant symptoms, you've tried lifestyle modifications, you've tried medications, or you're not a candidate for them, these treatments haven't given you any relief that you've been looking for, then I think this is a very appropriate next step. Ultimately, this is something that any point anyone's interested in talking to, we are always willing to have a conversation to determine their candidacy and see what would be the right steps for them. At the end of the day, the first way to start is just to ask. And so this is a proven therapy. There's at least an 84% satisfaction amongst those who use it for bladder control. And that's a national, or the Medtronic provided data. I would say with my experience in my patients, that's actually higher. We are higher than the 84%. We're probably closer to about 90 to 93%. There's 3 times greater improvements in quality of life compared to medications. 89% of people using the Medtronic bowel control therapy experience long-term success. Bladder, ultimately about the same. 400,000 patients have been implanted over the past 25 years. Ultimately, there are certainly, it's always important to talk about what possible adverse events or complications. And ultimately, some people will say that they have some pain at the implant site. There can be chances if you have a fall of lead migration. Certainly, any device has risk of infection. But what I can tell you is that under the right circumstances, with the right team who does this on a day in, day out basis, we are able to decrease those risks substantially and keep this as safe and comfortable a procedure as is possible. And so again, there is also an ambassador program. If you ever have questions or would like to speak with someone who has gone through the InterStim therapy, there is a ambassador program. We'll have a link on the next slide. But ultimately, Pat, made this comment: InterStim therapy has given me freedom from searching for restrooms or worrying about embarrassing moments. And so we hope that it could do the same for you. And so I very much appreciate your time tonight, and thank you for joining me for this presentation. I hope it's been informative and provided you with a little new perspective on what options exist and are out there for you. So essentially, we will have time for some questions, and I'll be happy to field those. But ultimately, if you have any interest or would like to hear more and chat more about this, please don't hesitate to reach out to our office, and we have staff who will be able to help schedule a follow-up appointment for you so that I can go through a one-on-one with you and see what would be right. If you mention the webinar as well, that will help to ensure that they do get you scheduled in a timely fashion in the predetermined spots that we have for this. So please don't hesitate to mention that. Also, if there's any questions at this point, I believe there will be a way for you guys to send those in a private manner. So I will turn it back over to our host.